The dynamic of how pharmacies operate has shifted dramatically over the past few years. We're well beyond the point of pharmacies just being a place to pick up your prescriptions. They're a critical part of any community. But with this shifting dynamic, how can pharmacies more efficiently manage bookings, client management, patient records, and all the other challenges while keeping their process seamless for both the pharmacist and the patient? With me today on the podcast is Hamish Mackellar, the founder of Fluger, and in this episode we talk about the shift from workplace vaccinations to pharmacy services, the expanding scope of services for pharmacists and the need for robust yet flexible technology solutions, and the importance of creating a streamlined and user-friendly experience. Collaboration starts with a conversation, Team HealthTech. Let's make it happen. This is Talking HealthTech with me, Peter Birch, featuring content and community about technology in healthcare. Hello, Hamish. How are you?
Good, thanks, Pete. How are you?
Good to see you. Thanks for joining for this conversation today. It's great to have you in the studio. Tell us a little bit more about you and what you do.
So I am the founder and owner of Fluger. Fluger established in 2020 as a corporate health management platform and has evolved significantly since then. But yeah, originally sort of in that corporate health space, helping companies coordinate vaccinations at the workplace, their staff, wages, rostering, all that sort of stuff, but also bookings and client management. And during COVID, we won some contracts that allowed us to, significantly upsize our business and look at other areas. And during COVID, we could see vaccinations were going from the workplace into pharmacy. And so it sort of gave us the trigger to have a look at pharmacy and see what sort of platforms were available there. And we realized that there was a big gap there. So we remodeled our A version of our system for pharmacy, and that's sort of where we're at the moment.
Yeah, got you.
Yeah.
So you saw a trend that, because I remember quite a while ago, 20 years ago, I'd go into, you'd have your annual flu vaccine program and your employer would sort that out and you go into the boardroom or whatever and get your vaccine. So you're saying that the trend is moving towards not so much doing it through your employer, but through pharmacies?
Yeah, definitely through COVID, that was a big push. We could see a lot of, I guess with lockdowns, everybody being at home anyway, it meant that, there just wasn't that volume going through the workplace that there was beforehand. So it just meant that we had to look at, I guess, for us, that was an emerging market. It was an obvious one for us to have a look at. So sure enough, there were vaccines definitely moving into that space, but there was also a bigger gap in terms of online bookings for pharmacies, but also patient management, patient record keeping, uploading data to the immunisation register, that sort of stuff. There were solutions, but they were hodgepodge and sort of pulled together at the last second when COVID rolled out.
Yeah.
So we sort of tackled it with the approach of providing a full end-to-end solution for pharmacy that meant a pharmacist would be able to access all those services from one platform without having to log in and out and change what they're doing, interrupt their daily workflow. Yeah, and so Fluger provides that solution for them.
Yeah.
Yeah.
Well, and I think about it the other way too, and how pharmacy has evolved over a longer period of time. There's this increasing discussion of how much a pharmacist does and where their scope of services lies, and then it ends. And we've you got a lot of pharmacies now, they've got consult rooms and there's other things that pharmacists are very capable of doing. And not just from the pharmacist side, but also the consumer kind of hopes or even expects that the pharmacist will be able to do. Tell me a little bit more how you've seen that scope of service kind of expand for a pharmacist.
Yeah, so the scope of practice has changed dramatically and the government is all the time expanding on that. So, for example, the contraception pill and the antibiotics for urinary tract infections, those sorts of things are being expanded out around the country through different state rollouts. And so I guess where Fluger really comes to shine is when a new product like that is needed for pharmacy to be able to offer it to their patients. We provide the system that allows the pharmacy to do that straight away. So they don't have to come to us and ask us to develop out a product for them. They can do it themselves. So using Fluger, the pharmacist can build the product in about 10 or 15 minutes. And then once they're happy with it, they save it and it's live on the platform. So the scope of practice as it changes using Fluger means that pharmacists can easily adjust to that change within a few minutes rather than waiting for a software development company to build out the product, which takes time. It's costly, but most of all, it means that often you get a product that is already old and too old for what you want it to be used for. And so, yeah, we give the pharmacies the ability to build the products themselves and be able to modify and change the scope of the software that they're using to fit in with what they need it to do. Yeah,
I imagine that makes a lot of sense. I guess from a pharmacist point of view, you don't want to have one platform to manage your travel vaccines and then another platform to manage, dispensing contraception or whatever it might be. So the being able to have a flexible tool to manage that, and I guess I imagine it's incorporated into the workflow to the pharmacist too. From a clinician side, that's very important. No doubt from a pharmacist, that's really important.
That's right. Yeah. So being able to build those products into their current workflow is really important. So getting them to get used to using a booking system for those services as well, which is quite important, so that they are able to then manage that workflow themselves internally, so that the patient has an experience that is what they'd expect, rather than just turning up and waiting around for an appointment. That sort of thing. We really push, even if they do turn up to the store, they use our system to book in to the next available slot. And the pharmacist then, sort of picks them up and feeds them, or, takes them through that journey of that workflow for the patient. And it just means that the pharmacist too has a structure to how they handle that workflow as well, rather than just sort of, hi, okay, better go and get something ready for you to do. So the structure's already there and the pharmacist just follows that workflow. That's
really important too, that patient user experience as well. I was thinking about the workflow from the pharmacist side, but in a world where, retail pharmacy as an example is very much, it says it in the name, it's a consumer's expectation might be to have a similar experience they have in any retail bricks and mortar setting. They've come into the pharmacy for an experience from a pharmacist's point of view in terms of retention and customer service, and just generally being a good social citizen. Being able to provide a good experience for the patient is going to be really important.
That's right. And giving them one spot to keep all their records together as well, so the patient can log back into the pharmacy's website and then see all their history for that pharmacy in one easy. So I guess still one easy location, which is really important. It also gives them the ability to rebook. So if they do want to come back next month or next year or whatever it might be, they can just log in and rebook again, which is just a really nice, sort of, I guess, end cap to keep it all together for the patient and for the pharmacy. Yeah.
How do you think about this, sometimes competing dynamic of you want to make it really easy to access and use, and a streamlined process for the pharmacist and the patient, but you're dealing with sensitive information. You want the data to be secure. So when you're creating this platform that needs to be flexible and agile, but also a delight to use, none of those words seem to be in the definition of a secure and boring platform. How's that tension going?
Yeah, so I guess we've built the platform. Well, my background has been in big data and IT security sort of for 20 years, and so we built the platform with security at number one. It's our number one pillar of our business. I think of it probably 80% of the day is all about IT security and data sovereignty and protection. And so I guess we have built the platform with that in mind, and then second to that is usability. So we are collecting medical records, so there are a lot of security protocols that we follow and that we enforce on even the development process, so that no one has access to that data except for the end user. Making sure that it's all compliant, all the code and our work is compliant to ISO standards. And making sure that security is ticked off each time we make a change. But also the functionality and the design of that process is in line with our ISO 27001 standards and HIPAA compliant standards as well.
I imagine then, like, partnering with. So I've gone through the relevant due diligence process with any large institution. They're required to complete a very in-depth spreadsheet or form. But often then you're leaning on the infrastructure that you've utilized to be able to talk about some of that expertise, right? So being able to partner on that side is really important.
Yeah, absolutely. And we've just recently started 2023. We've partnered with Google Cloud, so we've migrated our entire network across to Google Cloud. For that reason, they provide us with some incredible security standards that you just, almost impossible for a business our size to be able to get access to. But they offer it as part of their service, as part of their offering. And so that was one of the big reasons why we moved to Google Cloud, because of for starters, the ease of use of their network services meant that we can implement the protocols that we wanted to implement easily and cost effectively, but also, rolling out to other countries. That meant that we can easily spin up services in the US, New Zealand, over in Europe, those sorts of areas without huge startup costs, which would make it impossible for someone like us to be able to do that sort of stuff.
You wouldn't be able to do it another way. That's an interesting point. That so the platforms available globally. What kind of differences do you see in what the Australian market demands versus other parts of the world?
Probably the biggest difference between the US and Australia is the US pharmacies want to get the latest technology they can get their hands on. So it's a different sell to the Australian pharmacies. The Australian pharmacy or healthcare industry want a proven old platform that has experience and knowledge, and you have to be able to go in and sell that. So we've done fairly well in being able to sell our knowledge and our experience, but we haven't got experience as a platform in the Australian healthcare system yet. But we're getting there, so we are making inroads. But in the US, it's a different story. It's basically tell us how new and how fancy your software is, and they'll sign up. So so it is very different. But we have a lot of knowledge and experience in the business from healthcare as well as in IT and IT security. So that combined really brings together a really powerful product. And I can see in the next 5 or 6 years, Fluger will be in 99% of pharmacies in Australia. Yeah, I can see in the next 5 to 6 years, Fluger will be in 80 to 90% of pharmacies, just because of the way we've approached the technology and how we're bringing it to pharmacy, but also how we're bringing it to the patients, and giving access to the pharmacy with the data that they need to be able to get back to patients. So things like being able to market back to patients and get them back in for follow-up checks or, repeat scripts, that sort of thing. It's really important for us to be able to get that data easily to the pharmacist and have, good access to that so that they can use it the way they need to, rather than, holding the data ourselves and, sort of protecting it as if it's, not their data. It's realistically, it is owned by the pharmacy, not us. And so, for them to have access.
Well, that's a good point in itself, isn't it? The ownership of data in that kind of flow where you've got patient information, you've got pharmacists spinning up information. Likely there could be chains of pharmacies. Like there's all kind of permutations that you need. And I guess from a vendor's point of view, yes, there's a lot of value and opportunity that exists within the data that potentially you could then do lots of interesting things with. But yeah, like you say, in the end, it comes back to the pharmacy having the ownership and control of that data. Is that kind of how you think about it? Yeah,
that's right. Yeah. So I guess we are the gatekeepers in terms of looking after the data and storing it, but we don't own it. So if the pharmacist wants to move somewhere else, then they can do that. They can extract the data and import it into a different platform if they want to. But in terms of accessing the data and being able to use it accordingly, and appropriately, in terms of, it has to be in line with privacy standards and that sort of thing. But if they want to, invite customers to come back for, say, another flu vaccine 12 months later, they can do that really easily within our platform. They don't need to contact us and organize us to build a marketing campaign for them. They can do it all within the same.
You touched on the Australian privacy principles, and that's super important. And I was thinking about how globally scalable it all is, but like any healthcare system, everyone's got their own nuanced rules and regulations and requirements, and Australia is no exception. I know a little bit about it because there'd have to be integrations and connections through to different bits of the system, right? Like I imagine the Australian immunisation register is that it? And there's probably a few other kind of bits and pieces to how do you keep across all those and making sure they're kind of connected in?
Well, I guess for us, vaccinations were the big ticket item for us in terms of a product to offer to the pharmacy. So pharmacy then takes that product and offers it to their end clients or their booking system. But for us, vaccinations were the hardest because it had requirements that needed to be sent to the government. So through the immunisation register, we sent vaccination details. And so there's requirements that they enforce on us to be able to get that data to them. But there's also a whole lot of other complexities behind vaccinations. So, things like cold chain compliance, making sure the vaccines are, in date and, valid to be given to that person. So there might be online consent that would, validate the fact that you can have a vaccine. So all that sort of stuff is built into the platform so that when the pharmacist gets to the point of giving the vaccine, it's really only a couple of data points that they have to enter in, because the whole, checks and balances have happened before the patients got there. And so there's a lot of work that goes in behind the scenes to make sure that that patient is at that right point, and is able to receive that vaccine. So whether it be, pre-vaccination questionnaires or consent process, it gets to the point where they're only attending that appointment because they're able to, essentially. So the software coordinates all of that. Yeah.
Thinking then about, like where you're at now and how the offerings evolved and the focus, there's a few exciting opportunities there. Where are your priorities going to be over the next 6, 12, 24 months? Hamish, what can we look forward to seeing from Fluger?
And so we're working on a few large contracts at the moment, which we will be releasing more details on in early January 2024. So we're really excited about that. The work that we're working on at the moment will revolutionize how that platform interacts with the pharmacy going forward. So we're super, super excited about that. It's a really big step up from the platform as it is now. And that will be rolled out across the country in Australia later in 2024, which is really exciting for us. It's a really big, market share opportunity for us. And then on top of that too, expansion in the US is sort of our other priority. So our offerings in the US is also growing, and the number of stores over there that are picking up the software is also growing. So 2024 will give us the opportunity to put some funding over there and really push that as well.
Well, Hamish, I'll put the details for Fluger in the show notes of this episode. You mentioned Google Cloud and the partnership you've got there too, who are proud THT Plus members. So we'll include that in the notes as well. I really appreciate you making the time to come and have a chat on the podcast, mate. Thank you so much.
No worries. Thanks, Pete.
For more content and community about technology and healthcare, visit talkinghealthtech.com.